60 years ago, treatments for chronic kidney disease were few and far between. Patients with kidney failure faced imminent death as dialysis and transplantation were rare. Hope arrived in 1960 when the first arteriovenous shunt was inserted into a kidney patient and modern dialysis was born. Unfortunately, the shortage of equipment and the high cost of treatment continued to put this life-saving treatment out of reach for most patients. In 1965, the National Kidney Foundation advocated for the first federal grant from the Department of Health, Education, and Welfare, which helped build local facilities so that patients could access dialysis in their communities. But over the next few years, lack of insurance coverage and cost continued to be a barrier. So NKF pushed for enactment of the 1972 law that ensured that all people with kidney failure would be eligible for Medicare, regardless of age. With the Medicare ESRD benefit, all kidney failure patients could get the care they needed.
My name is Precious McCowan, and I have end-stage renal disease, and I'm a dialysis patient. Before receiving my second kidney transplant, I did in-center hemodialysis for 9 years, where Medicare was my primary insurance. If I didn't have Medicare, I would have been bombarded with so many medical bills. Unfortunately, my second kidney transplant only survived for 3 years. I am considering a living donor, and Medicare has really stepped in. I've had 2 people tested so far, and Medicare covered them for their testing. Having Medicare saved my life.
The 50th anniversary is a cause for celebration, but more work must be done. Dialysis, while a life-sustaining therapy, is not a cure for kidney failure and requires patients to receive treatment at least 3 times a week for 3 to 4 hours at a time. Home dialysis, which provides patients with greater flexibility in when and how often they dialyze, is significantly underutilized. Transplantation is the preferred treatment for kidney failure, but we have a fundamental supply and demand problem. More than 90,000 Americans are waiting for a kidney transplant, but only about 22,000 transplants take place each year. As we look to the next half-century, we must do more to transform the landscape of kidney care. With increased federal investment, we could accelerate the development of innovative, patient-focused kidney therapies such as artificial kidneys, portable dialysis devices, xenotransplants, and therapies that delay or reverse the progression of CKD.
Logan was 3 days old when they told us that there was a chance that he could have a rare kidney disorder called congenital nephrotic syndrome of the Finnish type. They effectively said that we're going to have to get to transplant. They basically said his kidneys are the problem. They are sick and they have issues. The longer they're in there, we're just going to continue to go through these same challenges. And so he was a month and a half when both of his kidneys were removed, and immediately we started on peritoneal dialysis. And because he had end-stage renal failure, both Medicare and Medicaid really got us to where we had the care, the medicine, the financial support for everything that went into taking care of Logan on a daily basis, getting us to transplant.
For 50 years, the federal government has been a partner in kidney care. We now call on the government to be a partner in kidney innovation. By investing in these kidney-related research, prevention, and innovation activities today, we can lead to the breakthroughs that kidney patients deserve. If you or someone you know is living with kidney disease, know that there is hope. With the right treatments and support, people can live longer, healthier lives. To learn more or to get involved, visit voices.kidney.org.